Hey everybody, I'm Kevin and this is Donna and welcome to the MedList. We're really excited to have you here with us. Donna, I think the theme to tonight's show is kind of an interesting one for me personally, and I'm sure you felt the same over the years. Is just life is so interesting. It's always changing and evolving the way that we think about our role in life, kind of our family situation, our career situation, whatever the case is, kind of just always is continually changing. We've had recent conversations about caregiving and our role that we can have in caregiving for my example, as a father, or caregiving as an individual that's taking care of elderly parents or grandparents or whatever the case may be. Savannah and I have had lots of conversations about both. We having young children, that's always something on how can we be better parents, what stage are boys at when they're developing, from going from baby stage to now, exploring sports, and Savannah is now homeschooling the boys. So lots of, fun conversations on that. We have right now the whole sandwich generation thought is part of our lives. We're starting to think about those things of what ends up happening when we have folks in our lives that are aging and might need a little bit of extra help, and how do we flex our roles in life to be able to do so, and all those pieces. But that's all exterior, Donna. Sometimes there's changes that are happening on the inside that I don't think we explore often enough. Right. Thoughts on that?
Yeah. So I know we're going to be talking about especially women's mental health and the hormonal changes that are going on. And to think of it, as I was preparing for this podcast, going back and saying, okay, yeah, I felt that. I remember that time. And you're talking about the sandwich generation, and I've lived it, still live it. So there's a lot. And then, how I reacted at different times. Maybe it was my hormones. Sure it was. That's what I'm going to say anyway.
It was my hormones.
Yeah, it was my hormones, definitely.
That was definitely a hormone deal right there. Yeah, I don't know. I mean, I think it's kind of funny because I went in, this is a personal story, but it'll be hopefully funny enough. And then Tim can edit it out if it's not. But went to the doctor a little while back, Donna, and I was visiting with John. John McCarthy is my physician over this way. Really good guy. And, I thought it's a good time to just go and visit and just get a checkup kind of deal. I'd love to be able to tell you. I mean, we're literally on a podcast about this, Donna, but I'm gonna tattle on myself. I probably haven't been to the doctor in like 15 years, for just like a general checkup. And I know I'm typical American male, especially, right?
Never.
I go in there, he's basically, Kevin, you're perfectly healthy, you're just fine, kind of deal. And I'm trying to just urge John along, like, hey, what other things can I get out of this appointment? Like, should I get labs checks, so on and so forth? And he's like, no, not really, Kevin. And I was like, well, I feel like my hair is thinning, a little bit. Is there something we can, do about that? And he bends his head down and goes, join the club. And I laughed. Anything, for being part of this club. And funny enough, with our previous guest, he said, you'll get your AARP card here pretty soon. No sympathy whatsoever from the physician. But that is an interesting thing for men and women, of just going through different stages of life. Sometimes it's related to our general activity or diet or exercise that we can make some of those changes as well. And sometimes it's just aging or just life events, that ends up happening. So very thankful to have our guest on to be able to walk us through those things, especially for women. And another thing that I'm thankful we were able to walk through is a couple episodes ago, we visited with Michelle, and there's just more and more people that reach out to you and I, Donna, about Remedy Chain and the work that they're doing related to donating medications to them, and then also receiving medications so that you can get set up with those meds that you can't afford or you can't find. And so wanted to educate the audience a little bit about how you do that and the simplicity of it, and just really the spirit of being able to get those medications you need and avoid any events that you don't want to encounter.
At Remedy Chain, we know throwing away perfectly good medicine feels doubly wasteful. It's bad for the environment, and it could have been used to help a fellow human in need. So we found a remedy. Now you can donate your unused meds. Our pharmacists inspect and certify every donation so it can be safely and legally redistributed to vulnerable patients. Visit donatemymeds.org and click the Donate Meds button. Unopened, unexpired medication in original packaging is eligible for donation. Open bottles, controlled substances, and temperature-controlled meds are not eligible for donation. Once confirmed, we'll send a donation form to sign and prepaid shipping instructions. And we'll let you know once we've matched your donation with a patient in need. Together, we complete the chain. Remedy Chain. Visit donatemymeds.org today.
Amazing.
Good stuff. Good stuff. So welcome.
Hello.
Hi, Erin. Thank you so much for joining us tonight. And I want to share a little bit about you. So Erin Tanner is a board-certified nurse practitioner and a leading expert in women's mental health with a career spanning almost 30 years. She specializes in providing integrated care that combines traditional medicine with holistic well-being. As a dual board-certified family and psychiatric-mental health nurse practitioner, Erin brings a unique and comprehensive perspective to her work. She's a trusted voice on a range of topics, including navigating hormonal shifts in perinatal mental health, managing depression, anxiety, trauma, burnout, and chronic stress, and finding balance and purpose in a demanding world. Through engaged and evidence-based presentation, Erin empowers audiences with practical tools and insights needed to transform their approach to mental wellness. So thank you so much for joining us, Erin, and I love your approach. Oh,
Thank you. So happy to be here. I think this is such an important conversation to have. I think any time we have a chance to bring some awareness and to open the doors to asking these questions that can be difficult is super important. So thank you so much for giving me a chance to do some of that.
of course, of course. So if you could just start by telling us a little bit about yourself and basically how you kind of come into this hormonal shift, if you will, and really specialize in women's mental health in the perinatal and the perimenopause span.
Sure, absolutely. So, I started out in this almost 30 years ago as a nurse's aide. I've worked as a registered nurse at the bedside, and then I went on and got my family nurse practitioner certification first, worked in primary care, internal medicine, did some home care, geriatrics, hospice, things like that. Never really got back to my true passion of maternal child health, but really learned a lot along the way about medications and, what we can really be doing to help people, and realizing that, we need a lot more education and preventative type work, not just take a pill, take another one, take this, do. And it was interesting when Kevin was talking about going to the doctor and just sort of, oh yeah, welcome to the club. And, I think a lot of times we go to the doctors and we give them this, list of symptoms. And they just kind of shrug or, oh yeah, well, it's your age or, whatever. And you feel sort of dismissed or, not understood. And I think it's really important for us to really listen to the patient, believe what they're telling us, and then sort of work backwards from there to find out what the cause might be, because it could be, and almost always is, multifactorial. But just saying like, yeah, it is what it is. Yeah, your hair's probably thinning, you're tired. Yep, you're a mom, you're working, like that's just the way it is. And that doesn't feel very good. So I really try to bridge that gap between the traditional medicine and the holistic wellness to provide people with that whole person approach so that they feel heard, and we can uncover what's going on and get to those multiple causes and provide them with some relief that's sustainable and isn't just medication focused.
Yeah. Can you share some of your approaches that you have in regards to, so somebody comes to you and says these things like, I'm exhausted, I'm a mom, I'm sandwich generation, or whatever, that scenario is, or a new mom, or, empty nester coming their way, whatever. And how do you approach that a little differently And I know that you do a lot of like group therapy too. So if you could share a little bit about that and that unique approach and what you find is so helpful.
Yeah. So, when somebody first comes to talk with me, if it is in a one-on-one session, we really do a deep dive on the whole person. We're looking at their physical, their mental, emotional, spiritual health, everything from, how are they sleeping? What does their dietary intake look like? What does their daily movement look like? What medications have they, tried before? What are they currently using now? How did they feel with those things, right? Just gathering as much information as possible. We sit together for about 90 minutes, sometimes a little more, and really gather all of that and try to draw from that, what may be contributing to how they're feeling right now. And I think it's really important for people to reach out for those one-on-one sessions, but it can still feel very isolating. And especially when you're going through a life transition or a mental health type situation, you kind of feel like you're the only one. Nobody understands. And so that's why I like to do the group workshops as well, so that it's an unintimidating, casual way for people to come and ask the questions they may have, or just sit back and listen and hear what other people are saying. Because I found for myself that it was oftentimes in those group settings that I had those aha moments where I really felt like, somebody else gets it. Somebody else has been there. That worked for them. Let me try it. But it just gave me a way to kind of dip my toe in without having to like say, hey, I'm depressed, or I think I'm anxious. And having been somebody who dealt with postpartum depression and anxiety and didn't know what it was, even though I was in healthcare for all these years, it really wasn't until I started doing work in the perinatal space specifically that it started to, I had my kids in 98 and 2000, and it really wasn't until like 2015 that I was like, oh, that all tracks back, and it just all fell into place. So I think it's important that we do things as groups to help take away the stigma and normalize how we're feeling, and that it's okay to not be okay, and to reach out and ask for help.
Yeah, for sure.
I think that's really, really helpful, Erin. I think the one thing that really struck me right there, and I'm sure it did Donna, is you said 90 minutes.
Yes.
Yep.
90 minutes is a long time, right? I mean, even if we feel like we need 90 minutes to be able to go through something, what have you discovered over time that you feel like 90 minutes is necessary to deliver this kind of care?
Yeah, so I guess it came down to always feeling like I was stuck in these like little 15 and 20-minute increments. And it was like you just finally start to make a connection with somebody, or kind of like break through to what might be going on. And it's like time to move on to the next. And I really hated that feeling as a provider, because I felt like it left the care disjointed, and I either wasn't asking the follow-up questions that I knew I should be asking because I just knew I didn't have the time.
Yeah.
Or, as a patient on the other side, being a consumer of this, there's lots of times I've walked into appointments and I get back in the car and I'm halfway home and I'm like, oh my gosh, I forgot to ask about blah, blah, blah. And then, I'm not going to see that person again, probably for a year or more. I'm not going to bother trying to call the office because I'm going to have it on hold. And, maybe I'll try to send them a message through the medical record, but will they get back to me? And it just sort of falls off the radar until it becomes a really big problem and I'm having lots and lots of symptoms or issues with it. So by giving us the 90 minutes, it allows us to dive deeper into different things that may come up through that intake process and the questions that we ask that maybe you didn't even realize were an issue or a concern, but it, kind of dings something in my brain to go, oh, that could be contributing to this. Let's follow that a little bit more versus, we might need 4 or 5 appointments to be able to do that in a traditional setup. And along the way, it's just very choppy. So this gives us that time to really explore what's foremost in your mind and what brought you to me, but then allowing me to be able to follow up and go down those different rabbit holes that might come up when we're talking.
Yeah, I love that. I think that the the two things that we underappreciate quite often that I love that you do not as a provider is, one is trust. Like if you don't spend enough time with an individual, you're just an individual that's going to solve X, Y, or Z problem, and that's what you're used for within society, as opposed to someone that's being leaned upon and trusted for multiple levels of life. And especially when we see a chronic disease epidemic hit us like we have right now, we have to be able to develop that trust. We have to be able to dig deeper. And I think we have to be able to open up broader, instead of touching on, hey, what is just the primary reason why you came into the clinic today? Being able to get into some of those details, I think, is so important. When you talked about, here are some of the details I like to dig into, and here are some of the patients that you like to work with, it's really broad, Erin. I mean, there's a ton that you have to cover when you said age 25 or maybe even younger to age 80 and likely older, right? You have individuals that are going through different life stages. Give us some ideas when you're going through the progression, of kind of life, especially with the women you're working with, what you're trying to get broader on depending on life stage. Like if it is a 25-year-old coming and Erin is doing a full workup and interview with this individual versus it being a mom that is just retiring, that is now 65 years old, what are the things you're asking, and kind of give us that broad dynamic of how it's different for different ages and stages?
Yeah, but I think no matter what age you are, it's really important to find out what you are doing right now. I think we make assumptions based on people's age. Like if you are 25, you are probably in school or just out of school and, maybe have a place on your own, or maybe with a few friends, or maybe you're still living with mom and dad, whatever the case may be. Versus like when you get somebody who's, in their 40s or 50s, you like assume they must have older children, or they're, established in their careers, and maybe they're starting to take on a caregiver role for an older adult or something. And people are choosing to have children older in life, later in life. So that may not be the case. And so then you're having women who are running into like, hey, I'm postpartum and I'm maybe like hitting some perimenopausal symptoms too. How do I, kind of manage that,
Great
perfect
points.
storm? So it really just becomes important to find out, what are they doing? What are they feeling? And then tailoring what we're going to do based off of what their needs are, what their struggles are, and what their goals are. And it really varies from person to person. And, I can sit down and think, oh, Donna's going to come to me with this complaint because, I know she's working and she's got kids in, their 20s and, blah, blah, blah. And then she comes in and it's totally something different. She's having issues with a friend or, something completely unrelated. And that's where her pain point is right then and there. And so, it really, people are not cookie cutter. There is not one magic pill. I tell people that all the time. I'd be super popular if there was, but there's not, and I certainly found along the way with trying to figure things out and like feeling dismissed by the traditional system myself, when I would go and do things like yoga, because I had this horrible hip pain for like 7 years that nobody could figure out. And while I'm in yoga, I get to the end and I'm in Shavasana and I just feel this overwhelming need to like cry. I'm like, whoa, what is that about? I came here to stretch. What's this emotional release that I'm experiencing? And then just working with people through like COVID and realizing that interconnection of when we have infection and inflammation in our bodies, how that really can exacerbate an underlying depression or anxiety or insomnia. Or maybe it wasn't even a problem for you before you got sick and now all of a sudden you're having this issue. So really appreciating that nothing happens in isolation and that we do need that holistic approach of looking at everything from the very basics up to, your day-to-day stressors and everything in between.
I love that. The last one I have before I pass it back to Dawn is this one is because it can be so broad and because you end up going into a 90-minute breakdown of what is happening. What's the reason that most women, and this could be stage related or not, why are they coming to see you in the beginning? What's the most common reasons why they go, you know what, I need to go and see Erin?
I think the most common thing is that they have felt dismissed and they don't feel understood, and they're struggling with mood changes. And they don't know what to attribute it to. Like sometimes they can be like, well, my baby's 8 months old, but I just have so much rage, or all I do is worry all the time, or I start something and I can't finish it. But they have just this random constellation of things they're feeling, and they go to the doctor and they have their labs checked and they're like, oh, everything's fine, you're fine, it's just anxiety or it's just stress. And you're sitting there going, well, okay, yeah, but what can I do for it then? Like, why is it making me feel like this? Like, I've been stressed my whole life. Why now is it, a problem? So I find that's why most of my clients are coming to see me now, is they're looking for the deeper dive. They're looking to do more of the work. They've either tried medications and they weren't helpful, or they had side effects, or they haven't tried medication. They're afraid of medication, and they're really looking for somebody who's open to the non-pharmacologic, more holistic approach, and they just don't know where to go. So they stumble upon me, and we try to figure it out and navigate it and do what we can.
Amazing.
So touching upon that a little bit, Erin, and just moving through, you shared with us before, when we were talking before the show, that how people feel is going to be based on different hormones that are maybe more present or maybe a little bit out of balance. If you could walk us through the hormones and why they're good for us, but what might happen if they're just not quite aligned as we need them to be. And then the other thing that you had said too is just like, I think it's so important, and I think it's such an important message that you're saying women might feel dismissed, and why you're just supposed to go off and live the way that you feel, and it doesn't feel good, it doesn't feel right. So I love what you're doing in this regard, and I think educating us on these different areas of hormones and how they work and the good and the bad of them, I think that is going to shed a really nice light on just helping women in general, no matter where they are in their lives.
Yeah, I certainly hope so. That's definitely my goal. But you're right. Hormone fluctuations definitely have a direct impact on our emotional and cognitive function. It goes beyond just being our sex hormones. Like, I think everybody, as soon as they hear hormones, they think sex, and it's just like, that's it. But it goes much deeper than that. Your estrogen, your progesterone, your testosterone have a big role to play in mood regulation, anxiety, sleep, energy, focus, mental clarity, things like that. So when we're talking about that, estrogen is typically thought of as our mood stabilizer. In terms of our hormones, it helps to regulate our serotonin and dopamine levels. It has neuroprotective effects for us as well, as far as that goes. But certainly when we're having fluctuations in that estrogen level during premenstrual times, like PMDD, the premenstrual dysphoric disorder, the perinatal period, where we can have perinatal anxiety, postpartum depression, perinatal OCD, postpartum psychosis, we can have massive fluctuations and sharp drops that can then trigger those disorders. And then perimenopause and menopause, we have this gradual and then significant decline in our estrogen levels, and that can then cause changes in our mood, depression, anxiety, mood swings, cognitive changes like that brain fog that a lot of people talk about. So when we think estrogen, we want to think more of like mood stabilizer. And then when we're thinking about our progesterone, that's more of our calming hormone. It has anxiety reducing effects because it works on our GABA. And as it declines, in postpartum, in our luteal phase, perimenopause, it can exacerbate our anxiety or cause sleep disturbances, insomnia, and things like that. So it's important to recognize that if we're having more of those symptoms, it may be a progesterone issue. And then our testosterone, which is linked with our energy levels and our libido, a general sense of well-being, our cognitive function and mental clarity. So if our testosterone levels are starting to come down, we may notice more fatigue or low interest in doing things, no motivation to do things, even things you used to like to do, or just a low mood. So, important to think again, just like I was saying before, nothing happens in isolation. These hormones don't act in isolation either. But, it's important to really think about that and take it into kind of the back of your mind. Like, okay, when these things are happening, it may be because of the hormonal shifts. And then, like we were talking about before with like life transitions, parenthood, career changes, having to care for aging parents or disabled relatives, changes in our relationships with our partners, those things can then exacerbate the stress that we're feeling and exacerbate anything that the hormonal shifts may be contributing to and how we feel as well. Chronic sleep deprivation, which can definitely happen early parenthood, as a caregiver, working, maybe you have to work 2 or 3 jobs to support your family or, just be able to keep a roof over your head. That chronic lack of sleep increases our anxiety, our irritability, depressive symptoms. It is important to make sure that we are getting adequate rest, and just a work-life balance.
The rest piece right there, Erin, which I love. When Donna was asking that question, I was wondering the exact same thing. I guess what you're bringing up here is, what are the biggest culprits? I mean, you mentioned life events, but sugar is a massive impactor, right, on what ends up happening with our hormones and how we process them. Our sleep is a huge impact. What other things would you say if individuals are starting to feel, even before they come and see Erin, if they're starting to feel a certain way, what things would you have them look out for that would, from clinical practice impacts their hormones negatively?
So definitely, kind of your building, your foundation blocks, your true self-care. I think when we talk about self-care, we tend to think of extravagance like spa days and things like that, but really it's adequate, balanced nutrition, regular exercise, and quality sleep. Sleep is where we rest and repair. It's essential for our emotional regulation, our cognitive function, for all of our systems. If we have infection or inflammation in the body, we're going to be repairing ourselves when we rest. And if we don't take the time to rest, our body's going to force us to rest. So it is important to take those cues that we're getting. But good nutrition is important too. You want to make sure that you're having adequate proteins, healthy fats like omega-3s, that your vitamin D level is adequate, because low vitamin D can cause mood shifts. We want to be thinking about our overall system. Is there something else going on? Is it thyroid function that could be throwing us off? Could it be something like a Lyme disease that's gone undetected, right? Like there's so many things. It could be chronic cardiovascular disease. It could be sleep apnea, right? Like there's so many, multifactorial. You can't just say you're feeling irritable, so it's the stress from work and it's the kids and you just need to relax, like go take a walk. Like that, we say regular exercise because it's important, because it's good for our cardiovascular health. It's good for our mental health. It's a mood booster. It's a stress reducer. It helps to regulate our sleep cycle. But just going for a walk is not like the cure-all. Like there's a lot more to it. So, definitely making sure those physical pieces are in place, but also making sure you have some mindfulness, self-care in there as well. Mindfulness practices, grounding exercises, breath work, they calm and help to soothe and regulate a very dysregulated nervous system that's constantly in this fight or flight mode. So our breathing, everybody says, well, I breathe all the time. A breathing exercise is very targeted, very focused. It's letting your brain know that you are okay. One of the first things that increases when we are in a fight or flight type of situation is our respirations increase. And then that causes a whole cascade of physical symptoms. Our heart rate goes up, our blood pressure goes up. We might feel dizzy, nauseous, sweaty, you name it. When we can slow our breathing down, we're telling our brain, hey, you know what? We're okay. We got this. We're okay. And it stimulates our vagus nerve, which is that gatekeeper of our parasympathetic nervous system, which is going to begin to reverse that whole physical cascade of symptoms. It's going to start to slow the heart rate back down. It's going to bring that blood pressure back down. And all the other things you were feeling are going to start to dissipate. We need those things if we're being chased by a tiger. We don't need those things to sit in parent pickup line or run to the grocery store real quick or try to sit and just enjoy, a movie with our significant other. And all of a sudden, we're overtaken by this feeling. So mindfulness is definitely an important piece of things. Yoga and gentle movement type exercises, again, connecting the mind-body experience. All these complementary therapies really aimed at just calming and balancing the nervous system.
Donna, if you and I had $1 for every time we heard that sleep, exercise, relationships, and nutrition are meaningful parts of our lives, I tell you what, I think every show, we've ever had Erin, someone mentions those things from every specialty we've worked with. So if we ever get a lesson that goes across, like, what is the MedList trying to tell the general public? I think you hit them for us.
Right. We're going to have the life list next.
Good. Yeah, definitely. Super important. And it's empowering too when you understand what's going on in your body and why you're feeling. So making that connection provides you with clarity. It helps you to reclaim your own health and wellness. And that's huge. If you just feel like a player in the situation and that you don't have any control over what's happening to you, it doesn't have the same meaning and impact, right? Like when we just give you a medication and say, take this because your blood sugar is high, or take this because you're feeling depressed. Sleep is a big one. Everybody comes, what can I take to make me sleep? Well, essentially a lot, but at the end of the day, maybe none of it's going to help. So let's peel back all the layers of that onion. Let's get down to what is causing you to not be able to sleep. And once you rule out all the physical stuff, we've got to look at those lifestyle and behavioral things, the anxieties, the stressors, those chronic everyday, all day things that carry over into when we're ready to lay down. And then we lay down and we have nothing else to focus on. And then we just spiral and we think and we think and we think. So having ways to mitigate that becomes important. And that's where your mindfulness and your grounding can really come in to help you to be able to kind of shut that down too, so that you can get rest.
Yeah. Sure. Awesome.
Erin, I want to talk a little bit about our younger women and thinking about contraception and what that does too, because I know through just years of dispensing medicines and hearing what young women have to say, and even thinking about like mood. Could this be causing my mood to be off, or more acne? And then they say, oh, take this one for acne, but now something else is off. And I think that there's such a fine line between different types of contraception, the strength of the different parts of the products for contraception. And I don't think there's a fine tuning that's appreciated. I've also heard a lot of young women say, I don't want to be on it anymore because, one, I don't like the way it feels. And I just, I want to be me. I don't want to be something on something. So have you heard all this before? I'm kind of assuming.
Yeah, I mean, I do hear that, and I hear it, with regards to like antidepressants and things too. People are like, I just don't like the way they make me feel. Certainly with oral contraceptives, I think they kind of get treated like multivitamins, like everybody just takes them and it's just supposed to be what we do, and there's no risk or side effects, and that's not true. There certainly are. I would say more often than not, women do tolerate oral contraceptives without any major impacts on their mental health. However, some people do have problems with mood changes, depression or anxiety with these synthetic hormones. Oftentimes it is younger teenage adolescent girls who are starting out, your brain is still developing. So when we introduce medications that are going to have a role on our hormones, which also then are responsible for the neurotransmitters that we're producing, that can change how you feel. So that can cause depression or anxiety, mood swing type symptoms. And certainly if they already have an underlying depression or anxiety, maybe something that hasn't fully come to fruition, or maybe something they have been getting treated for a little while, it certainly could exacerbate that as well. And whether or not and how much progesterone is in an oral contraceptive can make a difference too, because like I said, that's our calming hormone. So that can make a difference in how people feel when they take them. But they also sometimes will prescribe oral contraceptives, like with PMDD, when people are having fluctuations in their mood and they're noticing that it is worsened with their cycle. So it really, it depends on what's going on. It's important to have that full conversation with the provider that's going to be prescribing that medication, and also making sure they know all of your physical and mental health conditions, what other medications, supplements, herbal remedies that you might be taking, because there can be interactions, and we don't want you on birth control thinking it's going to be effective and something you're taking is decreasing its effectiveness, and vice versa. You don't want your oral birth control to be decreasing the effect of your mood stabilizer, like with lamotrigine, which is very effective for mood stabilization and bipolar depression. It's an anti-epileptic medication, so people take it for seizures as well. So it's very important that that medication stays at a therapeutic level in your system. And birth control can increase how quickly it's metabolized, and so your lamotrigine level can be lower than you thought. And so you could be very well managed prior to starting oral birth control, and then start your pill and start to notice that you're having fluctuations in your moods, or maybe if you're taking it for the seizures, you suddenly have a seizure. So it's very important to let people know when they're prescribing you medications, and not just think, oh, this is just birth control, like it's, whatever, it doesn't matter, because everything can interact and cause a problem. And it's okay to use them together, but it's just important to consider the interactions so that adjustments can be made for your safety and efficacy. So, yeah.
Oh, that's really helpful. I think the young women, older women conversation is one that we have to give some light to the other side of the coin when it comes to those individuals then that are on the opposite side of life, they've gone through menopause or they're going through menopause. What are some things there you'd have for advice and some things that you've seen in practice that you wish more people knew about?
Sure. So I think it's important that, if you're really feeling that your mood fluctuations are hormonally linked, your perimenopause, menopause, maybe your postmenopause, estrogen's depleted, what have you. Addressing that first and foremost, because if we don't address the underlying physical medical conditions, then no matter what we do for the mood, it's never going to fully affect how you're feeling because there's still that underlying physical medical issue. So it's important. Same thing if it's a thyroid issue or if it's a sleep apnea. Like if that's the contributing factor that's triggering all of this, until that is managed and under control, you're going to continue to feel fatigued. You're going to feel your heart racing, depressed, whatever symptoms you were having, they're going to continue to be there no matter, what holistic therapies we throw at it, whatever antidepressants or anti-anxiety or sleep meds, like it's still going to be there. We might actually be making it worse. So it's important, especially as we get older, to rule out those physical conditions first, and then look at what can we do from a non-medication perspective, because there is always a lifestyle and behavioral component, whether we're treating high blood pressure or diabetes, or we're treating your mood or your sleep. It's important to have that, again, those lifestyle and behavior, like we were talking about, your nutrition, your sleep, your mindfulness, all of that. But if you are already doing all of those things, and you've had a full medical workup, everything's been ruled out, and you've been working with a therapist, you've been going to yoga, you regularly go to Reiki, or, whatever it might be that you're doing all the things and you're still feeling stuck. That's when it becomes important to have that heart to heart to say, maybe now is time for medication, to see if we can balance chemically what's going on. Doesn't mean that you have to be on this medication for life. It may be temporary, but we need to level things out so that you are then able to really access all of those non-medication holistic therapies that you've been putting the work into, but you're just not getting the traction that you're hoping for. So that's when I would say, why don't we try a low dose of X, Y, or Z, depending on what the symptoms are, and see. And I've had people come back and say, I've done therapy for years and it never worked. And then, you took me off of a medication, or you adjusted a dose, or, you added this, whatever it was that we did with the meds. And I finally felt like I could do what they were telling me to do. Like it made sense. I was able to do it, and it helps. Like they're so shocked that it actually helps, because for years it didn't help. So, oftentimes we need both. It's not an all or nothing. It's what works together to make you feel like your best you. And that's what we want, is for you to feel like you again. So taking that time to talk to you and find out how you are feeling makes a difference in getting to the root.
Yeah, love it.
Sure. Can we touch back again on the group sessions that you have? The reason why is I'm thinking some might be very resistant to going to a group because we said that there's this whole stigma. And do I really want to be part of this group that now, they want me to talk or whatever it might be? Yeah. But I would also love for you to mention about, I know you just recently did an art class with with a group, and I'm like, that's awesome. I remember just like getting lost in whatever craft I might be interested in. It just kind of releases everything, and you're just thinking about that one thing, whether you're crocheting or, whatever it might be. I love it. So how did that work? How do these group sessions work? And then how did this whole art session work out for you?
Yeah, so the group sessions are really meant to meet you where you're at. They are meant to be low key. They are small. We never have more than 10 women in a group at a time. Usually we have about 4 to 6. And I like keeping them small just for that reason. It's very intimidating to walk into a room full of 20 or 50 people and be like, oh my gosh, I'm supposed to talk about mental health. Like, I'm supposed to say, hey, I've been really tired lately and really mad at my husband all the time, and I just yelling at the kids all the time, and I'm crazy. Nobody wants to do that. Nobody wants to do that. And a lot of times it's easier to, maybe even if you're seeking out one-on-one care, to ask about it in a more peripheral way, like, I think I might have PMDD, or maybe I have seasonal affective disorder, right? They're not as stigmatizing as saying I have major depressive disorder, right? Like, I don't want to be that person who's depressed, who has a psych problem. But if it's because of my hormones, or if it's because of the time of year, I don't know, that sometimes seems a little more approachable to people, and nobody wants to be labeled. So I do see that sometimes too. People will come in complaining about, and specifically saying I have PMDD. I did it myself. Guilty as charged. I didn't want the label, but I'm pulling up to work every day and crying for 10 minutes in the car before I go in, and I'm having to leave in the middle of my shift because I'm vomiting, and I'm getting the kids on the bus and then going back to bed. I got to a point, because it had never been addressed in the postpartum period, where it was unsustainable, but then I didn't know what to do with it. So I like the groups because you don't have to say anything. You can just listen and take it all in. And again, hopefully have that aha moment where you hear somebody say something that just clicks with you and you realize oh, it's not just me. The art one specifically, we just had that this weekend. We did do seasonal affective disorder. And we did mindful mandala dot art, which was so meditative in the experience itself. And what I like for the workshops to do is provide you with some of those hands-on grounding mindfulness practices that you can take with you and then use later that day or the next day, or whenever a situation comes up where you're feeling overwhelmed, like a breathing exercise, or expose you to these other holistic practices like yoga and art and Reiki, or whatever numerous ones that there are. So with this, we began with just a very easy guided meditation and a little bit of breath work, diaphragmatic work, to just ground us to the space, kind of center us to what we were going to be doing that morning. And then we talked a little bit about what seasonal affective disorder is and how it shares similarities with major depression, but how it is different and unique and specific. And then we went into the art. So we were very short on the clinical piece of it, right? It was maybe 15 minutes. And then we went into the art, and we created for almost 2 hours. And people, each had their own little canvas that they were able to do. I almost brought mine with me because I want to, I actually waterproofed mine so I can use them in the office for coasters because I love that. And I'm not artistic at all. And this is the best art I've ever done in my whole life. And I loved it, every minute of it. But, everybody had their own small canvas, and you could do whatever you wanted with it. You could have a black canvas, you could have a white, it could be blue, whatever. And you started with your dots, and you could, have a circle pattern. One woman did actually one that spiraled. It was really cool. And as I was doing mine, I tried to be so focused on wanting it to be perfect, right? Because I tend to be a perfectionist and I'm going to, do the best art ever. And I'm going to, be the best meditator ever. And, I'm totally missing the point. And I'm going. And all of a sudden I realized, as I would talk about this subject or that subject, like how we might treat it, or like, when it might be good to ask for help and blah, 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 I'd come back to my art and I was like, oh, I've lost the pattern. I'm like, oh my gosh, what do I do? So I started looking at it, and I remembered the words of Mary, the art teacher. She's like, go back to it and just find where you were. There's no mistakes. You can't do it wrong. And so I did. I went back in. And so it started to take on like more of like a constellation type of appearance to it. And then I went back in and I started like kind of connecting my dots. And then it took on like more of like a compass look to it. So it was like this compass and like constellation. And I was looking at it and I'm like, it's such like where I'm at right now in my life without even realizing it, because I'm so open to all of these new experiences and, the divine female and, just really understanding the world in a different perspective than just take your medicine, and medication's the fault, whether you took too much of it or you didn't take it. And that's why you're here and that's why you're sick. I'm just opening myself to Chinese medicine and just all of it. And I finally found my true north in that I want to be helping women with their mood and their anxiety and their previous trauma, which really underlies a lot of the, other mood disturbances that we have. So it was really, really fun to do that. Let me see if I can pull up a picture. I don't know if it'll actually come through for you guys. See them all.
I wish we would do that more often, Donna. I think there's some trends.
Those are tiles, each of them. So there was 6 of us that ended up doing the art that day. And everybody people started opening up, talking about their struggles with depression, how it affected their relationship with their sister, how they found their way back to each other and realized like, hey, we weren't really great sisters, but we are really good friends. And it like started a whole new chapter in their relationship, like in their 50s and 60s, like, where usually we see people just the wedge driving people further and further apart.
Sure.
They had come back to each other, and it was through one sister's struggle with her mental health and the other one saying, hey, you know what? I can't expect her to change if I don't change. And so they shared that with this group of people. They didn't know anybody. And it was just a beautiful thing. And then hearing other people say, yeah, I've been through that too, and it was nice, and some people cried. We laughed a lot, I would say, more than anything. We were able to share laughter and quiet. And I think that a lot of times we feel like we need to fill the void with noise. And that's what mindfulness really helps us to get comfortable with, is the stillness and the uncomfortable, and focus in on what we're feeling physically, emotionally, mentally. And, so it was beautiful, and it was really aligned with what I wanted for people to have the experience of, okay, this is what a breathing exercise really feels like and how it does help to center and ground you. And this is what art can do for you. And yeah, you might have to schedule an art class in order to do it, but you also can just get a coloring book or your own little sketch pad or some watercolors, and you can do this at home. You don't have to come to a class, but if you wanted that guided experience, you can. So, that's kind of how those go. And there's been great response to them. We did one where we talked about high functioning anxiety and depression, and we followed that up with, again, some breath work and yoga. We've done one on burnout, and we coupled that with meditation circle and Reiki and ear acupressure. So, again, giving people a hands-on real life, take this with you, but also this is something that you might find helpful. So I don't think people are necessarily exposed to all the other options out there.
Yeah, I love it. I think, Donna, the one thing that you and I have talked about so many times is you go into the pharmacy, you have an objective, you go in there, you pick up your drugs, and you go home. You go to the clinic, you go see the individual for the problem you have, you get the prescription or the surgery scheduled or the specialist scheduled, and you go home. You go to the lab, you get your blood drawn, you go home. So I think twofold. One is it creates a break from that sterile environment that we've created inside of medicine, for us to be human beings with each other. And the other thing that I think is interesting to those listeners that might be on here that are maybe apprehensive at first, they're like, that just wouldn't be for me, right? Is that there is such a significant level of isolation in our society right now that just the ability to be amongst other human beings is a massive win for us, I think, within medicine. Oftentimes, especially in behavioral health, ends up being even more of a self-fulfilling prophecy that we isolate and we don't see other human beings and we don't allow ourselves to be able to heal in a group setting. And I think there's lots for medicine to learn through having those kinds of experiences. And I've been to a couple of things, Donna, and I tell my little sister, who is an art major, I have no artistic abilities whatsoever, but I have a lot of fun when it's a group and you're all doing things with each other. And I think there's real therapy in it. The other piece is the bond, that you can form inside of those settings, like those constellations that Erin just showed us. I'll bet she knows almost every single person that drew each one of them. And there's all those interconnections, that end up happening that I think are really beautiful. But Donna, I know that we're running short on time. I'll pass it over to you for our last question.
Yeah. So I know, Erin, we spoke of this, and just briefly, I know it's important that you say this, that when does someone ask for help, or how do they seek help? And I will let you finish off with that tonight.
Yeah, I think it's really important that if you have concerns for yourself, if you feel like you're struggling or you're worried about somebody else that you see struggling, usually once we're thinking like, hey, am I struggling? Do I need help? But usually we probably are there. We need some help. Personally, I offer a 30-minute free consultation. It's called the Clarity Call. You can ask any of your questions. It's one-on-one. It is just with me. And I tell people all the time, it doesn't ask anything. It doesn't cost anything to ask, but it could be the one conversation that changes everything. And it's really important that we support ourselves and we support our loved ones, and having good open communication, and just feeling safe to ask those questions. So if it is your primary care provider that you feel safe and close to, if it is your OBGYN, if it is, a teacher at school, if it is somebody like myself that you see on a podcast and you're like, wow, like I just connect. I feel like she gets me. Reach out and ask the question, because it really is so important to ask for support. It's okay to not be okay. And I think that's something that we don't talk about enough.
So helpful, Erin. Well, thank you so much for joining us tonight. That's fantastic advice to be able to leave folks on. And thank you everyone for tuning in this evening. You can find us on the MedList on YouTube, Facebook, LinkedIn, all your streaming and podcasting kind of formats. And if you have any questions, please post them there. Thanks again, Erin, for your time. We really appreciate you
so much. This was great. I really appreciate this opportunity.
Yeah, thank you.
Thanks. Bye-bye.